Before the earthquakes of 2010 and 2011, the people of Canterbury had mental health problems well below the national average. In 5 years, mental health problems have climbed steadily in all age groups and at all levels of severity. The problems that we're seeing in the hospitals and in the community are continuing to climb. This is the sharp end of the problems that any city faces. Trauma from work sites. We see alcohol and drug-related problems. And more than ever, we're seeing mental health problems.
What we're seeing now is a result of chronic stress on the population of Canterbury. People who tell a story of multiple moves since the earthquakes, ongoing discussions and debates with insurance companies, and that creates chronic stress, and there's no doubt that that affects their physical health. The healthcare workers here are continuing to do a good job. Many of us have ongoing issues ourselves. You know, that stress has an effect on them as well.
Mental health is the ultimate index of a community's ability to cope and manage through the difficulties that have come after the earthquake. Our job is to support the community to do that, and we are stretched to do it.
There are many migrant workers who come in for the rebuild. Often they're people displaced from their families. They are presenting regularly to our emergency department. All these workers require healthcare, but the workers from overseas often aren't eligible for funding because they're on short-term visas. And the workers from other parts of New Zealand don't get funded in Canterbury.
Yeah, I'm from up north.
Yeah.
Can you tell?
Children's mental health presentations are continuing to climb.
We have an increase of young people, 18, 19-year-olds, coming into adult services in crisis. And we believe that's because their support systems are not coping as well as they used to. The schools, parents, wider community that normally would provide support and teach resilience are also struggling and not there for them as they used to be.
Canterbury District Health Board is one of the most under-resourced district health boards in the country. It is one of only 2 whose funding has actually gone down in the last 2 years. This is in the face of increasing pressure in the wake of a natural disaster. We have done well. We've been shown internationally to be doing well. But despite that, we are still faced with enormous pressure because we're constrained by our resources. We have been underfunded.